Hi, and welcome to the Muslim Sex Podcast. This is Dr. Sadaf Lodhi, and I would love for you to leave me a review of this podcast and also to share and like it and share it with your friends, see what they think, and let me know. I would love to shout you out on social media. And also, I would love for you to follow me on Instagram at Dr. Sadaf OBGYN, as well as TikTok. I also have started a YouTube channel at Dr. Sadaf Intimacy Coach. I'd love for you to follow me on all of those channels. And most importantly, I'd love for you to become a patient. I am now accepting telehealth patients for sexual health as well as menopause health in New York and Michigan. So if you are a woman that is looking for a doctor that understands you and can actually take the time to listen to all of your concerns, reach out to me. Reach out at Dr. Sadaf at drsadaf.com. And I would love to see you as a patient. And now for the episode. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and this episode is everything you need to know about intimacy, body image, and eating disorders. But before I get into it, the first thing I want to make very clear is that I am not giving any type of medical advice. So if you are having any issues with your health, please speak with your friendly neighborhood healthcare provider. And if you have any questions about your religion, please speak with your neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So, on today's episode, I am super excited to have on with me Dr. Rebecca Berens. Dr. Rebecca Berens is a family practitioner, and I will let her introduce herself.
Thanks so much for having me. So I'm Rebecca Berens. Like you said, I'm a family physician. I have a private practice in the Houston area, and I take care of patients of all ages. Family physicians, we say cradle to the grave. But I have a particular interest in patients who are recovering from eating disorders. And so I have a large percentage of my patients that are in that demographic. And it's a topic I'm very passionate about.
That's awesome. So I know you recently gave a talk as well on eating disorders. So maybe you can just go over for those listeners that may not be familiar with what constitutes an eating disorder and what are the most common types and how do you know if you have one?
Yeah, absolutely. So there are various different types of eating disorders described in the DSM, and this is something that gets updated every time they update the DSM. So the general gist of it is an eating disorder is a psychological disorder in which your eating pattern is being manipulated in a way that is physically and or psychologically harmful to your body. And so that can happen in a number of ways. It may be through restriction of food intake. It may be through purging of food intake. So that's like inducing vomiting, abusing laxatives, diuretics, excessively exercising, or it may be through binge eating with or without purging. So that's sort of the basic symptoms that you can see across a variety of different eating disorders. And all of these can have a negative impact on both your psychological health, social functioning, and then, of course, your physical health as well. And in order for it to be diagnosed as an eating disorder, we do need to see that psychological and or physical impact of the eating pattern. And so, often people who have eating disorders don't necessarily recognize that what they are experiencing, the symptoms they're experiencing, are problematic. They may feel it's very necessary for them to do the behaviors that they're doing for one reason or another. So it's often loved ones or healthcare professionals who are seeing these patients that are examining them, seeing the physical signs, seeing the psychological manifestations, and able to kind of bring to light that this is a concern. And so it's something that, I'm very passionate about educating physicians about, and then just the general public, and especially parents of adolescents, because adolescence is a very, very common time for eating disorders to develop, to be aware of some of these signs and symptoms.
Yeah, absolutely. So Definitely a lot of issues with body image. So, typically, what age do you see like these eating disorders develop? Do they usually happen in adolescence, or do you see them also in adults? What have you seen in your practice?
Yeah, so eating disorders don't always develop in adolescence, but that is a very common time, just because that's a period of transition. Both it's stressful going through adolescence. I think any of us that have gone through it can attest to that, or who've
Probably.
had kids going through it. It's a stressful time. There's so much change happening to you physically, mentally. There's body changes in particular that are happening. You're gaining weight. Your body shape is changing. Your body size is changing as you go through puberty, and that can just be a common trigger. Eating disorders are never going to be caused by just one thing, so it's not just that you have a body image concern and now you have an eating disorder. It's usually a combination of factors. So there's genetic factors, there's social factors, whether that's the societal and cultural discussion of what is the correct or incorrect way to eat or look or whatever else. Food insecurity can have a huge impact. um, your family of origin and sort of psychological dynamics going on in your family can have an impact. Trauma history can have an impact. So there's usually a combination of things going on that's going to result in an eating disorder, but there's something that kind of pushes it over the edge. And adolescence is a common one that does that. But it can happen in other periods of life where there's transitions, later in life, divorce, menopause. These are all also transitions that can have a lot of triggers for people. And so it's not necessarily just adolescence, but that's certainly a common thing. And a lot of the patients that I see typically are in sort of their 30s and 40s. And what they describe to me is having had thoughts or symptoms or concerns dating into their very early preteen years, like ages of 10 or 11, sort of around when puberty is starting, is a common thing that I hear.
Do you find it more in individuals that have like some type of psychiatric underlying diagnoses, or would you say it just doesn't matter? It happens in everyone.
So there definitely is an increased risk in a person who has another psychiatric condition, particularly mood disorders, anxiety, depression, bipolar disorder. That does increase your risk of developing an eating disorder, but that's not necessary to develop an eating disorder. And so there's so many common underlying triggers that can cause mood disorders and cause eating disorders that a lot of times patients have more than one thing going on, just
Mm,
related to whatever their underlying triggers were.
yeah. I'm curious to find out how you see that impacting intimacy.
Yeah, so intimacy is definitely something that I see hugely impacted in people who are struggling with eating disorders. The most obvious and thing that I think most people can relate to is if you're having difficulty feeling comfortable in your own body and with your body image. Obviously in an intimate situation, your body is very exposed. It's exposed to another person. That can be very challenging when you're already struggling with your relationship with your body to then
Yeah.
have that exposed to someone else.
Sure.
But also, so many people with eating disorders have a trauma history. And that trauma
Mm,
may or may not be sexual abuse, childhood physical abuse. Um, it may be domestic violence. It may be just complicated family dynamics with maybe an alcoholic in the family or someone else with substance use disorder in the family or someone else with an eating disorder in the family. Again, it's very genetic. And all of those sort of trauma triggers that also, as I'm sure you have probably discussed before, that impacts a lot of our self-image and the way that we just function in general. If you're holding trauma and you're holding that anxiety, you're in that fight or flight mode, it's very hard to shift your body into a more relaxed state where you can enjoy and participate in intimacy. So I definitely see that trauma being a huge trigger for a lot of people.
yeah, I can definitely see that. And especially, a lot of times when we talk about intimacy, we're referring to physical intimacy, but I'm sure also emotional intimacy, right? If you're not, emotional intimacy develops when you feel that you can trust the other individual. And if you feel that you're not able to trust them or be vulnerable with them, then that will definitely affect your relationship and your emotional intimacy. That if you don't have that, which a lot of times for women is the building block, then it's hard to move toward physical intimacy. And definitely in patients that have issues with body image, right? Physical intimacy can be a huge, huge problem. So I'm interested also to know what type of physical manifestations are there when patients have eating disorders?
Yeah, so one thing that I see fairly commonly is vaginismus.
Mm,
So, I think this all relates back to that same sort of, maybe there's a trauma history, maybe there's just like an anxious disposition or whatever it is that is increasing someone's likelihood of experiencing vaginismus, which is basically unable to adequately relax the vagina to allow penetration or to be able to enjoy penetrative intercourse. That is a super common thing that I see. And it's not a direct
mm,
result of the eating disorder. It's not related to the energy deficit or any of the eating disorder behaviors, but it just is something that I see very commonly comorbid. And a lot of times that has to do with trauma. And I'm sure you've probably seen this
yeah,
in your practice as well.
absolutely. Yeah.
Um, but there are also other physical symptoms that are related directly to the eating disorder behaviors. So you mentioned the emotional intimacy and being able to have that intimacy with someone else. That is definitely impaired in someone with an eating disorder. If you have a negative energy balance, you start to have differences in the way your brain is functioning. So
Mm,
your mood is not going to be as well regulated. Your neurotransmitters are not functioning normally the way that they would if you were adequately nourished. And that can
mm,
definitely impact your social functioning. One of the common things that we see is people's mood and their affect changes when they're malnourished. They're more withdrawn, their affect is more flat. It's harder for them
yeah.
to engage in intimate conversations. So it's not just because of the psychological stuff going on, it's actually also a physical manifestation of that negative energy balance.
Wow. Okay. I had no idea. That's really interesting, really important. What other things do you see?
Yeah, so another thing that you can see, and this is, I would say, probably less common, but certainly does happen in cases where there's been very severe restriction. Where we now are seeing sort of a shutdown in our normal hormone functioning. So the way I always explain it to people is if you are restricting your intake for a period of time, your body starts perceiving that as famine, right? So it's going to start to shut down any non-essential process in your body to keep you alive because it has to conserve energy, not knowing where the energy is going to be coming from in the future. And so what do we need to live? We need our heart, our lungs, our brain. Those all need to be functioning for us to stay alive, but everything else is going to kind of slow down. And actually, even the heart rate will slow down. So, gut function is one of the first things usually that people will see. They may experience constipation, feel full more easily because their gut motility actually just slows down as an energy conservation measure. But the other thing that we commonly see is the pituitary axis starts to shut down as
Mm,
well. And so many people are familiar with hypothalamic amenorrhea, which is when that hypothalamus pituitary axis actually starts to shut down production of hormones to stimulate menstruation. Because basically, what you've told your body is there's not enough energy around, so we can't be making babies right now. And so hormones are starting to shut down, your reproduction starts to shut down, and then you may actually lose the period. So, what can also happen there is estrogen levels can fall, and you can actually experience some of the vaginal dryness or vaginal atrophy that you might experience in menopause. And so that's sort of directly related to that energy conservation process. If we get to the point that hormone production is so severely limited because of that, you may actually experience that atrophy as well.
it's amazing. So many physical manifestations of what's going on, right? And with the eating disorders, definitely, I knew of the period stopping, which is what you were talking about with the amenorrhea. But in terms of the vaginal dryness, I mean, that all makes sense, right? If you don't have hormones acting on those ovaries, stimulating the estrogen and that progesterone to happen and to come about from the ovaries, then of course you're going to experience that menopausal symptoms, which can be, the hot flashes, the night sweats, the mood swings, also that vaginal dryness that women often experience. And that vaginal atrophy, right? Because estrogen is needed for all of those important activities to occur in our body. And when we don't have them and we're missing them, then definitely different physical manifestations will start to occur. So those are really, really important things. And I think sometimes we don't think about the secondary actions that happen as a result of an eating disorder. We just think of, oh, the person is, binge eating and then they're throwing up, or, they're really restricting their food, but we don't, it doesn't occur. All the other things that are happening to the body as well, right? When you have that decreased energy in the body, and what happens. I'm wondering, I'm curious, do you notice that a patient's hair starts to fall out as well?
Absolutely, yeah. So we can see thinning hair, nails can become more brittle. Um, there's a lot of more like angular colitis, dry lips, a lot of skin manifestations and skin, hair, and nail manifestations that can happen as well. And certainly, again, just these are non-essential things, right? Our body's focusing all of its efforts on keeping those essential functions alive and conserving energy by getting rid of those non-essential things, and hair is one of those. We do see, though, growth of lanugo, which is like that sort of fine
Mm,
baby-like hair on the
yeah.
skin.
Mhm, mhm.
So that usually grows as a means also of energy conservation, to hold heat into the body and reduce the need for the body to produce its own heat to maintain body temperature. So we do see hair growth, but it's not the same as hair on your head. You can see thinning hair on the head and then growth of lanugo on the body as well.
And I would think that actually all of that, the thinning of the hair, the brittle nails, and the dry skin has a lot to do with the estrogen, right? Those are symptoms that we will see in menopause as well, postmenopause. And so, the hair falling out and things like that, because there's estrogen receptors all over the body.
Mhm.
And so when that estrogen level goes down, everything is affected. And so interesting, and I'm sure, of course, like you mentioned, the hypothalamus is being affected. So of course your thyroid, right,
Yeah, yeah,
is also affected.
absolutely. Yeah, the thyroid is definitely something that we see decreased thyroid hormone production, and some people can actually end up getting erroneously diagnosed with like hypothyroidism when they actually have euthyroid 6 syndrome, as a result of
Mhm.
that energy deficit, and energy conservation. That again, it's just conserving energy by not producing anything non-essential.
Wow. Yeah. So, what would be the first step for somebody that realizes that they have, perhaps they didn't even realize that this is what was going on with their body, and that they were really almost, making it very difficult for their body to continue to form energy and perform the functions that it normally does? What would be the first step that they would need to take to basically help themselves try to get better?
Yeah. So, I think it's very important for a person who's struggling with an eating disorder to have the right team of people helping them. It's not just one person that's going to get you through this. You need a team. You need a medical provider, ideally, a physician who's well versed in eating disorders. You need a therapist who's well versed in the treatment of eating disorders, who can help with the psychological manifestations. And then you need a dietitian who can help you with ensuring that you're, you know, adequately fueling yourself so that you can restore any weight or function that was lost, safely. And
Mhm.
depending on your level of medical severity, that may mean that you're going to be treated at the level of an inpatient hospital or a residential treatment program, or you could be treated in like a partial hospitalization program, intensive outpatient, or outpatient only. Just depends on where you are medically and what's going to be medically safe for you. There's several great resources out there to help people find help. One of them is the National Eating Disorders Association, so that's NEDA.org, NEDA.org. They have a helpline, they have resources to kind of direct you to the right people. There's also a wonderful organization called Project Heal. That can help with funding. So this is something that sometimes is difficult to get full insurance coverage for, and or if patients are uninsured or underinsured, they have high deductibles. Maybe accessing treatment is going to be financially difficult for them. Project Heal can help them navigate that and provide them with resources to help financially with their treatment. There's several online treatment options now, which is really great and just opens up
Yeah.
access for people who are maybe in areas that aren't major cities and don't necessarily have a lot of professionals nearby. So there's several great online tools that are available for getting virtual care from a dietitian, therapist, and even a physician. So there's a lot out there, and it's a lot more than there was even 10 years ago.
Right.
But the first step is really important, and often is going to require a loved one helping to support that person, because, like I said, this doesn't feel like a problem necessarily to the person who's affected, um, or if it is a problem that they're feeling so. They may feel stigmatized about it. They may not want to talk about it. They're going to need some support for a person to get them to where they need to go. So having a trusted friend or loved one or partner who can help you navigate that process and keep you engaged in treatment.
That's so important to have that proper team. So do you have a team over there with you that works with clients or patients that have the eating disorder?
Yeah, so in my practice, the majority of the patients I'm seeing are people who have already gone through that initial treatment, and they
Oh,
are
okay.
mostly recovered or in recovery. And usually they have a team established from their treatment. I don't personally have therapists or dietitians in my office, but I work closely with therapists and dietitians in the community that are treating these patients. And then we have a wonderful specialty clinic here in Houston where patients who are more active or medically unstable can go and get properly referred to the appropriate level of medical care for their initial treatment. So I work closely with all of those professionals. And if I have a patient who is more acute or has a relapse out of their recovery and needs that, I can always refer them. But it's definitely a team approach, and definitely requires constant communication between the team as well to make sure that patients are getting the help that they need.
I can only imagine how vulnerable the patient must feel, right? I mean, discussing something as an eating disorder, which is highly stigmatized, and then finding that trust in their physician, and then trusting that that physician is going to send them to people that also understand eating disorders and can empathize and treat them the way they need to be treated, right? So
Yeah.
I'm sure that that must be a very difficult position for a patient, but having someone caring like you taking care of them, I'm sure that they can find the support that they need.
Yeah, I was just going to say, that is definitely a big thing, and one of the things that is a huge barrier for a lot of patients is going to a physician and having their symptoms or their concerns minimized or not believed.
Yes, yes.
Patients who it's a very small percentage of patients actually who have eating disorders and are actually underweight. I think it's about 6%. The rest are either in the normal BMI category or in the overweight or obese BMI categories. They're not necessarily underweight, but I think a lot of physicians, we have a lot to learn in med school. I think eating disorders was maybe one lecture my for his second year of med school.
Yes.
It's not something that we spend an inordinate amount of time on in our initial training, and so the vast majority of physicians are not going to have a lot of experience. Um, and there is sort of this assumption that if your eating disorder is that serious, you're probably really underweight and your labs are going to be off. In reality, labs are often normal until the very, very late, critical stages.
Mm,
And the weight can be normal or even above what is considered normal.
sure, sure.
And that does not mean that the patient is not suffering from still a very severe and serious medical condition. And so it is really important to get to the right professionals who really have an understanding of eating disorders and their severity, because it can be dismissed, especially in patients who live in a larger body.
Yeah. I think what you said is very important, right? Is that physicians have to look at their own biases and not have preconceived notions of what a patient looks like that may have an eating disorder. And a lot of times, if patients are more um, fuller bodied, then it continues to stigmatize them more, right? And they already are having issues with their body image. But then if they meet a physician that either if they don't believe them or dismisses them, then I think that only adds to their mental
Yeah,
trauma.
or
So,
prescribes them weight loss. I've seen that happen many a time, where someone is seeing a physician who's in recovery from an eating disorder, and the physician looks at their BMI and says like, "Oh, you need to lose weight. Here's some Ozempic." It's really,
um,
it really you really need to be understanding of what a patient has gone through and what's going on, and make the right choice for that patient, not based on an algorithm.
right. And to really get a good history and really talk to them. And I think that building that trust and honesty with your patient is probably really key in getting the patient the correct help that they need. and helping them to move on with their own struggles. So, really important work that you do. So, how would a patient or a client or somebody that is looking to get help with their eating disorder, how would they reach out to you? How could they get in touch?
Yeah, so my practice is called Vita Family Medicine in Houston. And I'm on social media at Rebecca Berens, MD, on Instagram and TikTok. But my practice is in the Houston Heights area. The website is vitafamilydpc.com. We are a small practice. We only take a limited number of patients each month. So we do just recommend reaching out through the website, and we'll get you onboarded as soon as we can.
That's awesome. Yes. And so hard to find a caring physician that really understands eating disorders. I think, similar to sexual health, right? We didn't learn about it much, and we don't, and often a lot of practitioners are not comfortable discussing it or talking about it. And so then patients are really left in the dark, right? They don't know where to go, who to go to. So again, really important work that you do. And so I'm so grateful that people have you to go to, somebody that really empathizes and knows and understands the disease process so that they can get the proper care. So thank you so much. And well, we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you are having any issues with your health, please speak with your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.